Welcome back to my channel. I'm Dr. Jansa Lassiter, and today's episode centers around healthcare fraud. In this case, a physician in Louisiana was found guilty of illegally distributing over 1.8 million doses of opioid medication. So, I will bring you my commentary as this is a reaction video, and then I will show you how the governmental agencies prosecute this particular type of fraud. So, let's get started.
A Slidell doctor has been found guilty of distributing drugs. A federal grand jury convicted 50-year-old Adrian Talbot of conspiring to illegally distribute more than 1 million doses of controlled substances. Those substances included oxycodone and morphine. Talbot owned and operated a clinic that accepted cash for prescriptions.
So what he was doing illegal billing for services not provided, and he had the quote bright idea to accept cash and tell the patients, hey, pay me this percentage discount and I'll give you these drugs without even seeing you, which is another type of fraud. But let's continue.
Was found guilty of 1 count of conspiracy, 4 counts of unlawfully distributing and dispensing controlled substances, among other charges. He was also found guilty of defrauding healthcare benefit programs more than $5 million. He is scheduled to be sentenced on October 23rd.
I'm being sorry.
All right, folks, let's actually read here what WGNO says, and I will add some more commentary for you. So, starting at the top, Dr. Talbot is facing a possible 30 years in prison after being convicted of healthcare fraud. That's a long time. Now, this was originally posted in 2024, 2 years ago, and as an update, he was actually convicted. But let's keep reading. So, July 23rd, 2024, Dr. Talbot was convicted for conspiring to illegally distribute several doses of controlled substances and defrauding healthcare benefits, which means he wrongly billed Medicare, which is a governmental healthcare program, and even Medicaid, which is governed by the state of Louisiana and the federal government. According to the U.S. Attorney's Office for the Eastern District of Louisiana, Talbot owned and operated MedX clinical consultants in Slidell, where people would seek prescriptions for controlled substances in exchange for cash. Let's keep reading. Talbot reportedly ignored signs that the people paying for these substances were abusing the drugs. After taking a job in Pineville in 2015, it was noted that Talbot had pre-signed prescriptions for patients that he had not seen. A key indicator of healthcare fraud is billing for services not provided, upcoding, duplicate billing, or what we normally call in healthcare administration, phantom patient syndrome. So in this case, he wrote prescriptions for people that he never even saw. In 2016, Court documents revealed that Talbot had hired another practitioner who was directed to also pre-sign prescriptions for his clinic. Oh, it keeps getting worse, doesn't it? In an investigation revealed that in an effort to cover up his actions, he falsified patient records. This is in accordance with what we call phantom patient syndrome because he wasn't even seeing the folks that he wrote the prescriptions for. Keep that in mind. Also, he billed these prescriptions to insurance companies such as Medicare, which is a federal health program. So he defrauded the federal government, y'all. Medicaid. So he defrauded the state of Louisiana and also fraudulently billed Blue Cross and Blue Shield of Louisiana as well. His convictions include conspiracy to unlawfully distribute and dispense controlled substances. This means the DEA is on his neck and got him. 4 counts of unlawfully distributing and dispensing these controlled substances, and that's just what they could find. 1 count of maintaining a drug-involved premises. Recall that this was his own company, so he called the shots. 1 count of conspiracy to commit healthcare fraud. According to this article, he faces a possible 10-year sentence for conspiracy to commit healthcare fraud and 20 years each for these other charges. Now let's skip over to the DOJ and read their press release. Usually when I come across cases like these, I like to read the original report by the governmental agency or the actual injunction. This is what we have here. Straight from the mouth of the Department of Justice, Louisiana doctor sentenced for illegally distributing over 1.8 million doses of opioids in a $5.4 million healthcare fraud scheme. Keep in mind, this is just the money that they could actually trace. The real number could have been closer to 8 million. Let's read. Released February 6th, 2025. This was after his conviction. A Louisiana physician was sentenced yesterday to 87 months in prison. That is 7 years for conspiring to illegally distribute nearly 2 million doses of Schedule II controlled substances, including oxycodone, hydrocodone, and morphine, and for defrauding healthcare benefit programs of more than $5 million. So we know that he owned and operated his own clinic. So he accepted cash payments. Okay, here's the key here. Whenever we are dealing with healthcare fraud, we have a triangle that Davies, who wrote Lying for Money, discusses as motive, opportunity, such as defective controls. In this case, the defective control was that this was his own company and he did not have to answer to anyone but himself. And third, he has his rationalization. He saw an opportunity and took it. While he was no longer present, let's focus on this part here. Although he was no longer present at the Slidell Clinic, he pre-signed prescriptions, including for opioids and other controlled substances, to be distributed to individuals there whom he did not see nor examine. That's billing for services not provided. In 2016, he hired another practitioner who, at his direction, also pre-signed prescriptions to be distributed to individuals in exchange for cash deposited into a medic's bank account. The evidence also demonstrated that Talbot falsified patient records to cover up the scheme and make it appear as though he was routinely examining the patients. Because typically, according to state law, you cannot dispense medication of any kind without a patient examination. With Talbot's knowledge, these individuals filled their prescriptions using their insurance benefits, thereby causing healthcare benefit programs, including Medicare, Medicaid, and Blue Cross Blue Shield of Louisiana, to be fraudulently billed for controlled substances which were prescribed without an appropriate patient examination or determination of medical necessity. Now let's skip down here to the bottom where this conviction is. On July 22, 2024, Talbot was convicted by a jury in the Eastern District of Louisiana on one count of conspiracy to unlawfully distribute and dispense controlled substances, 4 counts of unlawfully distributing and dispensing them, 1 count of maintaining a drug-involved premise because he owned this clinic, and 1 count of conspiracy to commit healthcare fraud. This is how he was caught. The Department of Health and Human Services, Office of Inspector General, Virginia's Chapter Office of Inspector General, the FBI, and the Louisiana Medicaid Fraud Control Unit investigated him. Folks, by the time these agencies show up at your door, they have been tracking you for quite a while. So although Talbot firmly believed that he could get away with it, and he did for so many years, rest assured that his sin found him out. That is it for today's video. I will see you in the next one. Bye now.